Hi there, I'm Dr. Sarah, staff veterinarian with Life's Abundance, and I'm here today to share with you some lesser known causes of bad behavior in dogs, specifically medical conditions that can cause bad behavior. One of the most common diseases that can cause abnormal behavior in dogs is cognitive dysfunction, or CD for short. CD is similar to dementia and can cause older pets to bark excessively and appear deaf or less responsive to your commands. It can also cause increased sleeping, disorientation, and loss of bladder and bowel control. Fortunately, treatments have been developed that can help with the symptoms of CD. Thyroid dysfunction is another disease that can cause behavioral changes in dogs. If you have a dog that is shedding excessively, gaining weight, and behaving anxious or aggressive, he or she may be suffering from low thyroid, which is easily treated with a thyroid supplement. Head trauma, brain tumors, encephalitis, which is inflammation in the brain, and seizure disorders can also cause a dog to act aggressive. And some dogs suffer from a genetic disease that causes behavioral seizures, which are partial seizures in the area of the brain that controls aggression, which results in bizarre aggressive behavior. And it's not just aggression that can be caused by underlying medical conditions. House oiling and destructive behavior can also be caused by medical issues that are underlying. If your previously house-trained dog suddenly starts urinating in the house, consider that she may be suffering from a urinary tract infection and need antibiotics. It is common for older spayed female dogs to develop incontinence and dribble urine, but this is easily treated with medication. Separation anxiety is another common disorder that can cause dogs to dig holes, chew at fences, scratch at doors, bark, howl, whine excessively, and soil in the house. But if your dog has separation anxiety, he's not being bad. He just has a condition that needs treatment. So if your dog's behavior is changing for the worse, the first thing you should do is schedule a checkup with your veterinarian. With a physical exam and maybe some tests, your vet should be able to tell you whether your dog's behavioral changes are due to any underlying medical conditions, and also advise you on options for treatment. And if you've already determined that your dog is as healthy as a horse and just behaving like a hellhound, get thee to a trainer. Most veterinarians are not trained in animal behavior, so we generally point pet parents with problem pooches to a good trainer that uses humane techniques. So ask your veterinarian, local humane society, groomers, or other pet professionals that you trust for trainer recommendations. Meet with the trainer and be sure you feel comfortable with their technique. The best thing, of course, is to prevent behavioral problems in the first place. Make sure your dog is part of the family, fed high-quality food, exercise daily, gets regular checkups, and attends socialization classes as soon as possible. Sadly, it is a known fact that 96% of all dogs surrendered to shelters never receive any training, so make sure your dog does not become one of those statistics. Thank you so much for watching, and check back soon for more episodes of Pet Talk with Dr. Sarah.